Hi. The other day, one of my patients had called asking if she should take vaccination for COVID, either the Covishield or Covaxin, because she was concerned that she's been seeing reports of blood clots with the vaccination. So I decided to make a video about clots, about what happens in a clot when a clot is formed, or why a clot is formed. What are the chances of clot formation with a COVID vaccine? What are the chances of clot formation with a COVID infection? And what can we do to try to prevent the risk of clots as such? So first, about what is a clot. So I'm sure you've always noticed that whenever there is any kind of injury, external injury, for example, you get a cut, within a few minutes the blood begins to clot, and then after some time, after a day or two, there is a scab formed, and after a couple of days you won't even notice where the injury is, right? So that's a body's way of repairing any injury which happens. Now, such things can happen inside the body too. You may not be noticing it, but if there are small minor bleeds anywhere in the body, clots form, and the bleeding is plugged by the clot, and then everything goes back to being normal. But sometimes clots can start forming even without an injury. When there is an infection, when there is an inflammation, also clots are formed. So what's been thought is SARS-CoV-2 virus, which causes COVID. You've again heard probably about the ACE2 receptors, which are the main place where the spike protein of the SARS-CoV goes and attaches to the ACE receptors, and that's how it gets into the cells. There are ACE2 receptors in the cells in our nose, in our respiratory tract, in the lungs, called pneumocytes, and there are also ACE2 receptors present in the endothelial cells. These are the cells which line our blood vessels. The inner part of our blood vessels is lined by cells called endothelial cells. These endothelial cells also have ACE2 receptors. So the SARS-CoV-2 virus is thought to go and get attached to this ACE2 receptors even inside the blood vessels on the endothelial cells. So once they get attached to it, they go into the endothelial cells. Once inside the endothelial cells, they damage the endothelial cells. There's infection, there's inflammation, there's damage. So once there's damage, there's proteins released, and then suddenly there is in the body there's an alarm that goes off saying, oh my god, something has been injured. So immediately platelets come to rescue. So the platelets, and there are certain clotting factors which are released together, they form a clot. Because there is an injury, they form a clot to plug the thing. Now, it's okay if it's a small clot, but then if clots start, because if there is more infection in the body, if this SARS-CoV-2 is going and getting attached to all the endothelial cells present in all the vessels and various organs in the body, then what happens? Lots of clots are being produced. Now, this clot can start blocking the blood vessel. Right, the blood vessels or the capillaries, the smaller capillaries or the blood vessels which are supplying blood to various organs in our body. Now, if this clot is formed and if it goes and blocks the blood vessel, then that organ which is being supplied by this blood vessel will not receive the blood supply, and that organ can slowly, the function of that organ can get reduced. It will start failing. Right? So this is what happens in COVID infection. All this is again just it's a hypothesis as to what could be the reason and what could be happening in a person who has severe COVID. Right? So how do we know if this clotting cascade and all this is happening? There are markers which are measured and called D-dimer levels. The blood reports show the D-dimer levels. If they are higher in a patient, then it's a marker that this clotting has begun inside the body, and then it could lead to shutdown of various organs. So thankfully, it's seen more in severely or critical patients of COVID, in hospitalized patients of COVID. But this is the mechanism of clot formation in COVID patients. Now, even in patients, so I started off with vaccination. So does this happen in patients taking COVID vaccine too? The scientists have been studying, following up with patients who had these clots, and during the clinical trials, clots have been noticed, but the number of people who have these clots is far less compared to people having these clots with COVID, for example, or COVID patients. If, for example, with AstraZeneca vaccine, out of the million people who have taken the vaccine, 5 people have been affected with clots. Similarly, with Pfizer, 4 people out of million have been seen to have clots. Versus if you see in the formation of clots in COVID patient is 8 times more than you see with a person who's been vaccinated with the COVID vaccine. So the chances of forming, what I mean is chances of forming clots is more if you are affected or infected by COVID than when you take a vaccine. It's a very low chance of developing a clot because of the vaccination. There could be other small side effects like fever, body pain and all that with vaccination too, but you usually recover. You probably will have 1 or 2 days of it and then you'll recover out of it. So nothing to worry about. You could just take a paracetamol and you would be fine. So what do we do to prevent or at least to reduce the risk of clot formation, whether it is due to COVID infection or whether it is probably due to COVID vaccine also? Basically, lifestyle changes again. As I always tell in all my videos, lifestyle is one of the very important factors for most of the diseases. You have a better lifestyle, a healthy lifestyle, your risk for most of the diseases comes down drastically. So it's the same thing in the case of COVID and clot formation in COVID too. If you are a person who is most of the time is sitting, is a desk job kind of a person, sitting for 8 to 10 hours a day, make sure you get up every 15 to 20 minutes, walk around for 5 or 10 minutes, and then you can sit back again. So take those breaks every couple of minutes and loosen your leg. Sitting for a long time in a place can also lead to higher clot formation. Stay active, exercise, get good sleep, rest it out, and of course eat healthy. And if you are a smoker, stop right now. Stop smoking, because smoking again is thought to increase the endothelial injuries that we talked about, and that could result in the starting off of a clotting cascade. So you would want to reduce the risk as much as possible. You don't want to have another factor to add to the infection. So please cut down on smoking or totally stop smoking. Drink plenty of water, and those are some of the things that you can do to reduce your risk of forming. By and large, if a clot has to happen, then after a vaccination, it is seen to happen after around 4 days or so after vaccination, and it can happen anywhere till 4 weeks. So what are the symptoms that you need to watch for? One is severe headache, which is not relieved even with your pain medications. Headache when you kind of lower your head, and which increases on lying down. Blurring of vision, nausea, vomiting, severe abdominal pain, again not relieved by your regular medicines. Leg pain, swelling of the leg, breathlessness, seizures. All these could be some of the symptoms which could point to a probable clot in any of the organs. So please make sure you contact your doctor if you have any of these symptoms after the vaccination has been taken. As I said again, it's a very rare phenomenon, but if you have any of these symptoms, please make sure you contact your doctor immediately. So I hope I made myself clear about clots and COVID relating COVID infection and clots and COVID vaccination and clots. With this information, please make a right decision. My advice, go ahead, get that vaccine, and at least it'll reduce the severity of the infection and may reduce your risk of hospitalization. And stay safe, but continue to mask, continue to sanitize, continue to wash your hands and keep that social distance. Okay, stay safe and see you again in the next video. Bye bye.